Facial nerve. In its facial nerve give three branches in facial canal. Greater petrosal nerve, now to stapedius muscle, chorda tympani branch. Greater petrosal nerve, floor of middle cranial fossa and goes towards pterygopalatine ganglia. Runs in lateral wall of middle ear cavity and then joins the lingual nerve at inferior temporal fossa. Facial nerve has geniculate ganglion in middle ear cavity which send peripheral process to chorda tympani nerve to carry taste sensation from anterior two-thirds of tongue. Facial nerve exits cranial cavity at stylomastoid foramen between styloid process anteriorly and mastoid process posteriorly. Then supplies some muscles of facial expression. Also supplies stylohyoid and posterior belly of digastric muscle. Nucleus tractus solitarius, tip of nucleus tractus solitarius, receives taste sensation from anterior two-thirds of the tongue. It receives information as follows. Anterior two-thirds of the tongue, chorda tympani, then to facial nerve, then to geniculate ganglion. Sends central process to tip of nucleus tractus solitarius. Superior salivatory nucleus. It is present in the lower pons. It controls 5 glands through the facial nerve. It has 2 ganglia, pterygopalatine ganglia. It controls the lacrimal, nasal and palatine glands. Submandibular ganglion. It controls the submandibular and sublingual salivary glands. Ganglia, pterygopalatine ganglia, submandibular ganglia. Nerve carrying preganglionic fibers, nerve carrying postganglionic fibers. For pterygopalatine ganglia, preganglionic fibers are greater petrosal nerve. Postganglionic fibers are branch of ophthalmic and maxillary nerve. Submandibular ganglion. Preganglionic fibers are chorda tympani. Postganglionic fibers are lingual nerve, branch of mandibular nerve. Internal carotid artery has T1 sympathetic plexus around it. It forms a sympathetic nerve called deep petrosal nerve. Deep petrosal nerve joins the greater petrosal nerve at the floor of foramen lacerum. Together, they form viridian nerve of pterygo canal, which finally reaches pterygopalatine ganglia. Viridian nerve can be blocked by vidinectomy in case of vasomotor rhinitis with intractable rhinorrhea, not done nowadays. Bell's palsy. Facial nerve supplies following muscles. Orbicularis oculi to shut the eyelid. Orbicularis oris to shut the mouth. Zygomaticus muscle to pull the angle of mouth for smiling. Frontalis muscle. Buccinator muscle. In Bell's palsy, there is a lesion in the facial nerve. Therefore, muscles on same side are paralyzed. Clinical features. On affected side, the patient cannot produce wrinkles on forehead, cannot close the eyelid, cannot pull angle of mouth, has dribbling of saliva, has dryness of eye, has decreased saliva. Problem with taste sensation on anterior two-thirds of tongue. Angle of mouth is deviated on normal side. Glossopharyngeal nerve. It's a mixed nerve, both sensory and motor. Motor fibers of glossopharyngeal nerve supply the stylopharyngeus muscle. Stylopharyngeus muscle. It develops in third pharyngeal arch. Sensory fibers of glossopharyngeal nerve carry sensations, pressure reception and chemoreception from carotid sinus and carotid body to lower part of nucleus tractus solitarius in medulla oblongata. Carry taste sensation and general sensation from posterior one-third of the tongue. Carry general sensations from tonsils and soft palate. Motor fibers of glossopharyngeal nerve supply the stylopharyngeus muscle. Sensory fibers of glossopharyngeal nerve carry sensations from carotid sinus and carotid body to nucleus tractus solitarius in medulla oblongata. Carry taste